Hello everyone, I'm Dr. Vinhi Desai, practicing ENT and voice surgeon at Desai Orthopedics and ENT Clinic, Borivali, Mumbai. Firstly, I want to wish every one of you a very happy Diwali and a prosperous new year. On the occasion of Diwali, I want to talk about hearing loss, and this is a sudden onset sensory neural hearing loss. So, sudden onset sensory neural hearing loss is a hearing loss which happens suddenly. There is an abrupt loss of hearing, usually one sided. Patients mostly remember the event, how the hearing loss has occurred, and most of the times the history is that the patient got up in the morning and suddenly one ear has become totally deaf. For a lay person, it is usually like a heart attack of the ear. The ear has suddenly lost its hearing. It can be associated with vertigo and tinnitus. So, this condition is an emergency. You have to visit an ENT surgeon immediately to start the treatment as early as possible. So, when the patient first comes to you, the patient is usually quite stressed and panicked because obviously one ear he or she is unable to hear. On examination, the ear externally is normal, and then we proceed for the audiogram. Audiogram is to know what is the level of hearing. So on audiogram over here, what you can see are two lines, rather four lines. Okay, the upper one is red in color and below is blue. So red is the right ear and blue is left ear. So the ear up to 20 decibel is normal. So on the vertical axis is the decibel level, and on the horizontal axis is the frequency. So here the blue has gone below, if you can appreciate, and the red one is at the level of 20, which is normal. So the left ear has suddenly lost its hearing, and the hearing loss is quite severe. So then we have come to the diagnosis that the patient has had a sudden onset sensory neural hearing loss. So now the next plan is that we have to counsel the patient that this is an emergency and this requires urgent admission. Firstly, we also have to tell the patient that the treatment we have to start early, but the prognosis remains guarded. The earlier the patient comes to you, usually if the patient comes to you within 72 hours, the results are good. As the delay happens, the results start getting poorer. So in this, first and foremost, we have to try to find the reason why this has happened. So causes are multiple. The causes could be vascular, which could be because of a stroke, or there could be an underlying hypercoagulable state or a thromboembolic phenomenon. It could be secondary to any infection such as bacterial or viral, any immunological conditions such as autoimmune conditions such as rheumatoid arthritis. It can give rise to this condition. Malignancies such as vestibular schwannoma, meningioma, neurofibromatosis, or any bloodborne malignancies which can give rise to a hypercoagulable state can give rise to this condition. Inner ear fluid disturbances which are seen in Meniere's disease can also present with a sudden onset sensorineural hearing loss. It could be secondary to trauma, and certain ototoxic medications can also give rise to this kind of a situation. Next is an MRI of the brain should be done to find out whether this has happened because of any neurological condition. So the cause is found usually in only 15% of cases. Rest of the cases the cause is not found, and hence we usually term this condition as an idiopathic sudden onset sensorineural hearing loss. So we have already admitted the patient, we have evaluated the patient, we have done the investigations, and we have come to the conclusion that there is no cause found. So then the next plan is that we have to start the treatment parallelly. So the mainstay of treatment is intravenous steroids. So we start off with intravenous steroids. We also give some vasodilators, antivirals, multivitamins. There is a role of intratympanic steroids. So steroids, as we all know, have understood that steroids form the mainstay of treatment. There are certain conditions, such as if the patient is having an uncontrolled diabetes, we cannot give intravenous steroids. So then we have to give steroids directly inside the ear through the eardrum, which is called as intratympanic steroid. Now, next is a very short video wherein you would be seeing me perform the intratympanic steroid. So this is the left ear. An endoscope has been inserted and there is a needle which is entering into the ear canal. So I'm injecting 40 milligram of Kenacort, and here I'm injecting into the posterior quadrant. You can see the middle ear getting filled up with the steroids. This procedure is performed under local anesthesia. Uh, Patient is awake. After the injection has been done, the patient is advised to lie on the opposite side. The patient has to avoid swallowing. He has to avoid nose blowing and talking for 30 minutes. This basically helps the fluid to enter into the inner ear. If the patient swallows or talks or blows the nose, it will enter into the nasopharynx through the eustachian tube. So we want the steroid to enter into the inner ear through the round window. So we start off the treatment with intravenous steroids, antivirals, vasodilators. We give intratympanic steroids, and we do a serial audiogram. Spontaneous recovery can happen in 65% of cases. The recovery can happen at 2 weeks, 3 months, 6 months. The prognosis remains guarded in patients who are elderly, who have comorbidities such as diabetes, if they have renal issues. If there is a delay in the treatment, then there is a risk of poor prognosis. If there is an associated vertigo or tinnitus, it indicates there could be the prognosis remains guarded. If there is no response to any of the above treatments, then we can advise the patient a hyperbaric oxygen therapy. So now I would like to discuss a patient who had come to me, who was a 65-year-old lady who had diabetes and vertigo. On the left side, you can see the audiogram. The patient had a severe sensorineural hearing loss, and once we gave the patient intratympanic steroids, intravenous steroids with vasodilators, and this is the audiogram which the patient showed at day 5. So the audiogram is done on the first day, the third day, and the fifth day. Intravenous steroids usually are given for 5 days, and depending upon the response, you can continue with intratympanic steroids. Next, the patient would share her story with you all so that you understand that this is a situation we must be very cautious of, and as soon as possible, you have to visit an ENT surgeon because the delay from your side could be uh, you lose your ear forever. Thank you.
मेरा नाम शीला पटेल है। मुझे 27 अगस्त को मॉर्निंग में 4:30-5 बजे के बाद सुनना बंद हो गया था और कान थोड़ा भारी लग रहा था। फिर बाद में लगभग 2-3 घंटे के बाद मुझे चक्कर आना स्टार्ट हो गया और चक्कर पहले थोड़ा आया, फिर जैसे बैठती हूँ तो ज़्यादा हो जाता था और बाद में और भी 1-2 बार खड़े होने का स्टार्ट किया मैंने, लेकिन 2-3 घंटे के बाद वापस इतना ज़्यादा चक्कर आया कि मैं खड़ी ही नहीं हो पाती रही थी। फिर बाद में मुझे डॉक्टर को मैडम को बोला कि ऐसा ऐसा है, बच्चे लोग ने फ़ोन पे बताया तो उन्होंने मेरे लिए दवाई चक्कर के लिए और वो दिया तो थोड़ा ठीक लगा। फिर बाद में वापस 12-12:30 के बाद मुझे वॉमिटिंग स्टार्ट हो गया और वो भी कम नहीं हो रहा था। फिर हम मैडम बिन्नी बिन्नी बिन को दिखाया 4 बजे, तो उन्होंने बोला कि इमरजेंसी है तो आपको एडमिट होना पड़ेगा। तो बस, और बाद में मुझे इमरजेंसी में एडमिट होना पड़ा। वहाँ पे मुझे डॉक्टर ने सब ट्रीटमेंट दिया, तो एक दिन में तो मुझे चक्कर वगैरह सब बंद हो गया था। और बाद में दूसरे तीसरे दिन के बाद मुझे इंजेक्शन दिया 3 दिन, और 3 दिन इंजेक्शन देने के बाद में मुझे और भी अच्छा हो गया। थोड़ा चक्कर भी काफ़ी कम हो गया था। फिर थोड़ा थोड़ा धीरे धीरे करके सब अच्छा हो गया। और ऑडियो भी लिया था यहाँ पे पहले ही दिन, लेकिन बाद में ऑडियो के बाद मुझे सुनाई कम दे रहा था। बाद में मुझे ऑडियो के जो डॉक्टर्स हैं उन्होंने मुझे ट्रीटमेंट ऐसा ऑडियो का वो ले रहे थे, तो धीरे धीरे करके मेरा सब अच्छा हो गया, सुनाई देने का भी और चक्कर भी सब बंद हो गया, मतलब काफ़ी कम हो गया ऐसा। और मैं पहले चल फिर को भी कम था मेरा, तो अभी मेरा अच्छे से अभी मैं चल फिर सकती हूँ, बहुत काफ़ी अभी अच्छा है। यहाँ हॉस्पिटल में आने के बाद मुझे बिन्नी बेन ने चेकअप किया, फिर ऑडियो भी निकाला, और बहुत ही अच्छा स्टाफ वगैरह भी बहुत ही अच्छा सपोर्टिंग है। डॉक्टर्स भी काफ़ी सपोर्टिंग मुझे लगा, बहुत ही अच्छे हैं डॉक्टर, और मुझे बहुत ही अच्छा लगा यहाँ आके। बाद में धीरे धीरे करके मुझे बहुत ही अच्छा हो गया।